Do you ever feel like you're constantly rushing to the bathroom? Or suddenly getting a powerful urge to go but not making it in time and sometimes having accidents? Or maybe you're waking up again and again during the night just to use the restroom. If that sounds familiar, you might be dealing with an overactive bladder. I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to talk in detail about overactive bladder. If you're new here, I share content about sexual health, bladder health, urologic health, and much more. If you enjoy this kind of information, be sure to subscribe and feel free to share this channel with your friends. So what exactly are the symptoms of an overactive bladder? There are 4 main signs to look for. The first is frequency, which means needing to urinate more often than usual. In medical terms, going more than 8 times a day is generally considered outside the normal range. Of course, if you're drinking a lot more fluids, you'll naturally go more often. But if it starts interfering with your daily life, that's when it becomes concerning. Another common symptom is urgency. This is the sudden, intense need to rush to the bathroom that you simply can't postpone or hold back. Sometimes this urgency can lead to bladder leakage or an accident, which is known as urgency urinary incontinence. And finally, waking up more than once during the night to urinate is also considered abnormal. This condition is called nocturia. When all of these symptoms appear together, they form what we call overactive bladder. The most important factor with these symptoms is the impact they have on your quality of life. At its core, overactive bladder is a condition that disrupts everyday living. But the effects often go beyond simple inconvenience. It can influence how productive you are at work, because if you're constantly getting up to find a restroom, it becomes difficult to stay focused and complete tasks. It may also interfere with your social life and lead to isolation, since you might avoid outings if you're unsure whether a bathroom will be available. Some people even feel the need to plan every trip around restroom locations because they worry about accidents. Activities like going to the movies or taking long drives can become stressful or nearly impossible if bathroom trips are happening too often. There can also be a financial impact. Many people end up spending a significant amount of money on absorbent pads, protective underwear, diapers, bedding, and other supplies. Over time, those expenses can really add up. When you consider all of these challenges together, it's clear that overactive bladder can become a major issue. Research has shown that roughly 16% of the population experiences these symptoms, which means it's actually quite common. In addition, it can also begin to affect intimacy and relationships in the bedroom. So if you're experiencing accidents during intimacy, it can understandably make you hesitant about being sexually active. That kind of worry alone may reduce your desire to have sex. Now you might be wondering, what actually causes an overactive bladder? One common factor is aging. As people get older, many begin to notice symptoms related to overactive bladder. That doesn't mean these symptoms are considered normal. It simply means age can play a role in why they develop. Being overweight can also contribute to urinary leakage. In fact, studies show that women who are obese are about 3 times more likely to experience episodes of urinary incontinence compared to women who are not obese. In addition, having had vaginal deliveries or multiple pregnancies may also increase the likelihood of developing these symptoms. Certain medical conditions can also lead to an overactive bladder. Some of the most common include diabetes and depression. A history of surgery in the pelvic area, such as a hysterectomy, or prior radiation treatment in that region, may also play a part. Neurological conditions can be another important cause. For example, multiple sclerosis, Parkinson's disease, spinal cord injuries, or a stroke can all contribute to bladder control problems. In some cases, even surgeries designed to treat leakage can influence bladder symptoms. Procedures like a mid-urethral sling or a pubovaginal sling, often performed to treat stress urinary incontinence, which is leakage during coughing, sneezing, lifting, or exercise, can sometimes create what we call an obstruction or blockage of the urinary passage. When that happens, it may actually make overactive bladder symptoms worse. There are a few other possibilities to keep in mind as well. Repeated urinary tract infections can trigger symptoms similar to an overactive bladder. Certain medications can also play a role, especially diuretics, which are often called water pills. These are commonly prescribed for conditions like high blood pressure or swelling. While they help the body remove excess fluid, they can also increase how often you need to urinate and may significantly worsen overactive bladder symptoms. When you visit a urologist to discuss symptoms of an overactive bladder, the first step is usually a detailed conversation. We'll ask several questions about what you're experiencing, when the symptoms happen, how many pads you might be using in a day, and which symptoms bother you the most. We'll also ask how frequently you're using the bathroom during the day and how often you wake up at night to urinate. Your medical history is also important. We'll talk about any past health conditions or surgeries that could be contributing to the problem. After that, a physical examination is usually performed. During this exam, we check for any physical issues that could be related to your symptoms. For example, we look for abnormalities such as cysts near or underneath the urethra, the urinary passage sometimes called the P-tube. In men, we also perform a prostate exam to evaluate whether the prostate might be involved. If the prostate is enlarged, that can very often lead to symptoms of an overactive bladder. If you'd like to understand more about what a prostate exam involves, be sure to check out my previous video where I talk about prostate exams in men and even react to the Try Guys. We'll also test your urine to make sure there's no blood present and no urinary tract infection, because either of those could point to other underlying problems. In addition, we may perform a bladder scan, also called a post-void residual test. This is a small ultrasound of the bladder that helps us see how well you're emptying it. In other words, are you emptying your bladder completely, or is your leakage happening because a large amount of urine is left behind after you go to the bathroom? Now, let's talk about treatments for overactive bladder. As I mentioned earlier, excess weight can play a role in worsening these symptoms. Research has shown that losing even about 8% of your body weight can make a real difference. For example, if someone weighs 200 pounds, losing around 16 pounds could significantly improve urinary symptoms. So, weight loss can be a very helpful place to start. Another step is avoiding things that can irritate the bladder. I've actually made an entire video about bladder irritants, which you can watch if you want more details. But some of the most common triggers include alcohol, caffeine, spicy foods for some people, acidic foods, artificial sweeteners, and carbonated drinks. What I usually tell my patients is not to completely overhaul their life all at once. Instead, remove one item at a time and see how you feel after a few days. If nothing changes, you can add that item back and try eliminating something else. The key is not to make yourself stressed over it. It's also important to drink enough fluids, but not too much. Drinking excessive amounts will naturally make you go to the bathroom more often. On the other hand, drinking too little can cause your urine to become very concentrated, which may irritate the bladder lining. The advice I usually give my patients is simple. Drink what you normally enjoy with breakfast, lunch, and dinner, and then sip from a bottle of water during the day. Try to avoid taking large gulps or forcing yourself to drink huge amounts. If you're eating fruits, vegetables, soups, and smoothies, you're already getting additional fluids from those foods, so dehydration is unlikely. Of course, if you feel thirsty, you should absolutely drink. Another major factor to pay attention to is constipation. Constipation can create significant bladder issues. The reason is that the rectum sits directly behind the bladder. When the rectum becomes full because you haven't had a bowel movement, it can press directly against the bladder. This pressure reduces the space the bladder has to expand, which can increase feelings of urgency and make you need to urinate more frequently, often worsening your symptoms. Another important step is quitting smoking if you smoke. Smoking not only makes overactive bladder symptoms worse, but it's also a major risk factor for bladder cancer. Because of that, stopping smoking is extremely important for your overall health. You may also benefit from seeing a pelvic floor physical therapist. These specialists can guide you through exercises that help retrain your bladder. One way to think about the urge to urinate is like a bell curve. When that urge suddenly becomes very strong, most people immediately rush to the bathroom before the feeling passes. But if you pause and distract yourself with a few quick Kegel exercises, you may notice that the urge gradually fades. Once the sensation decreases, you can then walk calmly to the bathroom instead of rushing. Of course, before starting any Kegel exercises, it's important to see a urologist for an evaluation. That way, we can make sure there aren't other issues, such as a high-tone pelvic floor, that might require a different approach. If lifestyle changes and exercises don't provide enough relief, medications are also available. These medicines work in different ways. Some help reduce the contractions or squeezing of the bladder, while others help the bladder relax so it can hold urine more comfortably. And if medications still don't solve the problem, there are additional treatments to consider. One option is a bladder pacemaker, which I've also discussed in a previous video. Another treatment involves bladder Botox, where small injections of Botox are placed into the bladder wall. The effects usually last about 6 to 9 months, so the treatment does need to be repeated during that time frame. Both bladder Botox and the bladder pacemaker are about 80% effective in reducing symptoms of overactive bladder. Another option is called percutaneous tibial nerve stimulation. It works somewhat like acupuncture. A small needle is placed near the ankle to stimulate the posterior tibial nerve. That nerve travels upward to the nerve roots that influence the bladder. By stimulating this nerve for about 30 minutes once a week for 12 weeks, and then once a month afterward, many people see significant improvement in their symptoms, typically around 60 to 70%. There's even a newer device now available that can be implanted near the ankle. This small device can stimulate the nerve automatically at home, meaning you wouldn't have to visit the office as often. Early studies are very promising, showing improvements in overactive bladder symptoms of up to 70% after a quick and straightforward office procedure. So I want to reassure you that there are many tools available to help manage and improve overactive bladder. If you're struggling with these symptoms, please consider seeing a urologist so we can help find the right treatment for you. And remember, taking care of yourself is important because you truly deserve it.